part where everyone who's watching is saying, I can't hear anything yet.
I can see them, but I can't hear them.
So good afternoon, everybody who's in so far. We're going to be starting our next episode of Inside Out in just a couple minutes. We're going to wait for a few more guests to enter the Zoom. So be patient. We'll be back. Okay, it's probably shortly after 3 now, so I think we will get started. So welcome, everybody, to Inside Out. This is webinar episode 5. We're going to today be talking about the difference and how to identify whether a place you're investigating is independent living or assisted living, or maybe the place even has both. I'm Carol Ann, for those of you who haven't met me before, working here at Knollwood on a daily basis, even through COVID. And I've been working for other communities like Knollwood for many, many years, nationwide, but now I work just for Knollwood. With me today is Vicky McRae, and Vicky McRae is also on the team here at Knollwood, and her area of focus is sales and marketing. So welcome.
Welcome.
So for those of you who haven't joined with us before, let's just give you a tiny bit of background on Knollwood. So we are a nonprofit community. We're in a wonderful, wonderful location, very scenic, kind of nestled in a neighborhood. You might never know we're here unless you took a drive down Oregon Avenue. The people who live here are 62 plus, and Knollwood is a life plan community. To be a life plan community, you have to have at least independent living, which is no care, and skilled nursing, which is full care, on the same campus. And in addition to independent living and skilled nursing, Knollwood also has other levels of living, which are
Assisted living,
and
skilled nursing care.
and what's in the skilled nursing?
We offer rehabilitation for any joint replacements after a three-day qualifying stay in a local hospital.
And memory
And
care.
memory care.
You forgot about that one, didn't you?
Absolutely.
Yeah.
We have memory care as well.
So we're going to move on to our next slide here in our deck. And so heard from Vicky. She's the manager of healthcare admissions here, and she also does community outreach.
Yes. And I was recently married April the 30th, just in case you see the Vicky McRae Parker.
Yes.
I'm married.
McRae is her maiden name, Parker is her new married name. And Vicky's focus here at Knollwood is assisted living, plus the 3 areas within skilled nursing. But she's also very knowledgeable on independent living. So because of Vicky's expertise, that's why she's here today. And she'll probably take the majority of your questions. Now, if you do have a question, you can type it in or key it in while we're talking. If it pertains to the slide that we're on, we'll take the question then. But if it's something that's a little bit of a different topic from the current slide, we'll save it for the end. So thank you, and now we'll move on and begin our show. Okay, so these are the things that we want you to feel you've achieved after you've watched this session. And so these goals relate to those of you who may be investigating communities so that you know whether a community you're investigating, is it assisted living? Is it independent living? Or maybe it offers both. What kinds of terms and maybe unusual acronyms will you encounter? And how do you know the difference between um, the ways to qualify for independent living versus assisted living? And we'll even talk a little bit about payment options. So that's kind of the goals that we're going to have today. And we're going to move next onto a little bit of a test. So Becky can review your test.
So our first scenario is that Jane and John live in a community that offers socializing, educational programs, housekeeping, and dining. Both need reminders to take medicine. Jane gets around easily, John slowly. Jane no longer cleans or cooks, but their apartment has a kitchenette. Jane has help showering. John has a stable but chronic illness. In what type of community do Jane and John live?
Now, we're not going to tell you the answer now because we're going to proceed, but before the end of today's session, you'll get the answer. So, you know, if you have a minute and you've got a notepad in front of you, just jot down where you think Jane and John live, and then you can find out if you're right later on. So now we're going to go to one more test on the next.
And here's scenario 2. Julie lives in a community offering socialization, educational programs, housekeeping, and dining options. She gets around easily, but no longer drives at night. Julie no longer cleans and cooks less than past 2 years. She has diabetes, and sometimes she cheats on her diet. In what type of community does Julie live?
Again, we're not going to tell you the answer to this one, so you have to stay tuned in, and hopefully by the time we get to the answers, you will have already figured it out from what we've talked about. So we're going to move forward and kind of get into the meat now. So I did mention earlier that Knollwood is a life plan community, and to be in that category, you do have to have independent living and skilled nursing. We also happen to have memory care, rehab, and assisted living. But some communities are not life plan communities. They might be what we call freestanding. And a freestanding community may offer independent living, or they may offer assisted living, or they may offer both, or they may claim to offer both. There's a little bit of a difference. And we're going to go into what those differences are as we move along in the presentation. So we're going to kind of delve into the lingo first. So with a life plan community, there's actually more than one type. In this area of the United States, there are 3 main types, A, B, and C. And what they are is it deals with the financial aspect of the community and what you're paying for while you're in independent living. So for a type A, which is also called life care, you will be paying the cost of care while you're living independently, whether or not you would need long-term care later on. Now, the modified life care is the next type, and that is where you're going to pay a little bit more in independent living because they're going to give you a little bit of a discount at a time that you need care. And then the third type is what Knollwood offers, which is a type C, which is fee for service. And with that, none of your healthcare long-term care costs are prepaid. You would only pay if and when you needed those services. So continuum is another term that you might hear. And continuum is on that previous slide. So we're going to go back one. And a continuum is a reference to the fact that a community may have more than one level of living. And the levels of living that we have here are the independent living, assisted, and skilled nursing.
And memory care.
And memory care, that's right, yes. And we also have plain old long-term care as well, yes. Another term that's important to know, and maybe not that important, but it's important to understand the activities of daily living. And there are two different types. Well, one is actually instrumental, but I have it typed wrong on my slide here. That's my fault. So this slide says independent activities of daily living, but it should say instrumental. So the next slide defines instrumental activities of daily living. These are the things that we typically do for ourselves. So you run a household, I run a household. You people who are watching run a household. So you're managing things, you're maintaining the house, you're making sure the gutters are cleaned, whether you do it or someone else that you hire. You're doing probably your shopping and food prep, or maybe you're having groceries delivered during COVID. You know how to use different devices. So if you needed to order groceries, you would either use your phone or your smartphone or a tablet or computer, or if you needed to call 911 because you burned something on the stove and caused a little house fire, you'd know how to do it. So using devices properly, managing money, business type. The business aspect of life is the instrumental activities of daily living. There's another type, which is going to be shown on our next slide, which is just the general category on our next slide for the activities of daily living. Now, these are not called instrumental. These are just called activities of daily living. And these are things that actually show you need help. You're not truly an independent person anymore. And to kind of give you a rundown and explain some of these, we'll have Vicky do that.
Okay, so the activities of daily living for assisted living is that you may need some assistance with bathing, with your hygiene and grooming, that you may need assistance with dressing yourself, eating, and toilet hygiene and functional mobility. With the functional mobility, you may have a cane or a rollator. These are some of the things that assist you with your activities of daily living each day.
And sometimes people need help with just one or two of these, and sometimes people may need help with several of these. But these are typical types of assistance that you're going to find in assisted living, not independent living. And when we're talking about independent living versus assisted living, what we're sharing with you today, you could be looking at a place in Arkansas because you have family in Arkansas, and all of these explanations will pertain across the United States. And now we're going to get a little bit deeper, and we're going to look at some of our acronyms. You may find a lot of acronyms out there and they drive me crazy. I don't use them. I like to use words because everybody can understand words. So you've got, you can all read the list here, but you will see that we have separated out instrumental activities of daily living as well as activities of daily living, and the Centers for Medicare and Medicaid Services. We wanted to point those out. I know we had a question about long-term care insurance because I can see that on the screen. Long-term care insurance is going to vary by policy of when you can use it and what you need help with. So there's not a blanket statement or a blanket answer about can you use your long-term care insurance, because it really depends on the clauses of your policy. Yep.
Right.
Yep.
It does depend. It depends on what type of policy you invested in and how much it will pay towards the room and board. So most long-term care policies will cover assisted living, some of the monthly fee.
But not all, but we're actually, for whoever asked that question, we're going to be doing long-term care insurance workshops at Knollwood. You actually, we've got some invitations going out in the mail very soon. So hopefully you'll get that invitation. If not, give us a call. If you don't get an invitation within 2 weeks, we're going to do several workshops. They're going to be very small, but they're hands-on. It's not something that can be done over a Zoom or over the phone because we actually need to dig through your policy. and they'll be COVID friendly because we'll be taking a lot of precautions and making sure that no one is in anyone else's space. So I just did want to mention that while we're here. So I think now we can move on to our next list of acronyms. And these are related to different therapies. So if you go and you have, let's say you're a big skier and you've really worn out your knees from skiing, and you may have a knee replacement or hip replacement, then your surgeon may prescribe for you physical therapy when you're after your surgery. Occupational therapy and speech therapy are typically more for sometimes disability type items, or for example, let's say you were laid up in the hospital for a long time with a hip replacement. You might also need some occupational therapy, which could include how to get in and out of your car with your new hip. What's another good example of occupational?
Also, occupational therapy has a lot to do if you're debilitated, as far as your reading and writing as well. Speech therapy has more to do with if you need to feed yourself, and also with reading and writing as well. So if someone had a fractured hand, they need physical therapy for strengthening of for their upper body, as well as the physical therapy for the lower body exercises.
And speech language therapy, or actually speech language pathology, is a little bit more intense than speech therapy, because speech therapy works with speaking, but speech language pathology
deals with more of the disease of maybe if someone had a stroke, it deals with the disease of the stroke, Parkinson's, that's right. And a lot to do with memory care as well.
And swallowing.
And swallowing, yes. Absolutely.
And we're not done with our acronyms yet. So now we have acronyms related to nursing. So we're going to, did we miss one? No. Okay. So you will see a lot of different acronyms. So the first two are pretty much exactly the same. It's just that in a different state, one may have the word licensed in front of it, but in some states, they won't, but the first two are really equivalent. The third bullet has two different variations for an assistant director of nursing. So sometimes you may see either or, but they mean the same thing. And the assistant director of nursing has to be a registered nurse.
That's correct.
The last two acronyms for nurses, it also depends on what state you live in. And the qualifications for a licensed practical or a licensed vocational are basically the same, but they have different titles depending on the state. And they're not able to do quite as much as a registered nurse. Okay. And you may also have heard of, and I didn't think to put it up, but advanced practice registered nurse. Right. Sometimes an advanced practice registered nurse may have a geriatric specialty, and sometimes not. But they can do more than a nurse, almost as much as a doctor, and can also prescribe. So that's another acronym you may encounter in nursing. Now, slightly related to nursing, but also related to assisted living, are the type of aids. And some states have both of these types of aids, and I'm just noticing a typo here. The second one is not can, it should be the other way around.
That's right, CNA.
Yep, so I made a little typo there, I apologize. But a certified nursing assistant and certified medicine aide. And the difference between the two is?
The certified medicine aide actually can just give medicine like an LPN, but they're only certified in certain states. And I know Maryland that they're certified to give medicine. Certified nursing assistant is actually certified in any state, and in DC and Maryland as well. We only have certified nursing assistants here at Knollwood.
So at Knollwood, if you needed medications while you're living in assisted
nurse, right?
Yeah.
The LPN would be the licensed practical nurse.
So in assisted living, you would be receiving any medications from a licensed practical nurse at Knollwood or anywhere in Washington, D.C. In Maryland, it could be either or. And that's a good example. Okay, thank you. And just when you thought we might be done with acronyms, a couple more. And these two, they have the same schooling. So both types of social workers have a master's degree. One has just gone on beyond that and gotten professional licensure as well. And you'll find these across the board in every state of the US. Some assisted living communities will have a social worker, but many do not. So it's not always necessary, or it's not a regulatory requirement to have a social worker working in an assisted living center. And I think now we're going to move into some comparisons. Okay, so now you kind of know what the acronyms are, and hopefully we're not going to use any more acronyms today. We're just going to use words. But for comparison purposes, if you're looking at a community and you're looking at an apartment home, how do you know just by looking what you're looking at? And the reason that I think it's important for you to know the visual cues are because there are many assisted living communities that market or promote themselves as independent living communities. So when you're looking and you see a kitchenette, an independent living apartment home is going to offer a full kitchen, could be very much like the one you have in your house or your condo right now. You're going to have different dining plans or options for dining, and maybe no dining requirement. But assisted living has regulations. And so in assisted living, that's when they're giving you 3 meals a day because they have to by law. So that's why you only need a kitchenette. And another thing to look at, and this is even before you enter the building, you may see parking lots, garages, but for independent living, you're going to see a lot more cars at a community like that. And that's because the residents are going to have 1 or 2 cars. Very seldom is somebody who really needs assisted living going to be capable of driving. So that would be few and far between. How many people in assisted living in Knollwood have cars, Vicki?
At this moment, we have one.
Okay,
One.
so just one here. So
one.
that's pretty.
We've had it a while. He hasn't moved it, but we have only one.
Yeah, it's because it's very rare to
It's
have
very
that
rare.
ability
Right.
and require assisted living. Another good difference to help you differentiate is when you're looking either at the floor plans or a pricing sheet for a community. If they have a list of apartment homes and prices that's long, then you're going to be looking at independent living. For assisted living, you're typically going to have just a few different floor plan choices because it's more important that you're receiving help and assistance versus having a lot of different options and sizes for apartment homes. What can you say about the apartment homes in assisted living in Knollwood?
Most of our apartments in the assisted living are single apartments, so they're basically for one person. And there's a reason for that when you're doing assisted living, because everyone will need a different type of care. And our apartments are few floor plans, and they're probably at 420 to 520 square footage.
Yeah. So they're a little more compact.
Right, they're very compact.
Yeah, you don't need as much space, and there are fewer. It's very rare to have a couple using assisted living because typically people's health doesn't necessarily decline at the same time. Right. So often, if one of the couple is having trouble, but the other is still robust and fine and dandy, they may be able to live in assisted living together. And it might be easier, they may be able to live in independent living together. So usually couples can avoid assisted living or put it off, if you will, and provide the support. It's easier in a community than in your house to do that because you don't have as many of the responsibilities in a community that you would in the house, so things become a little bit easier to stay together longer. And then I think the other very good factor that I really wanted to point out here is if you look at the 5th bullet down on the assisted living side, if you ask a community when you go to visit if they're assisted living or skill or independent living, and they tell you they're independent living, but you're just seeing kitchenettes and you're not seeing a lot of cars, and you found out that all the meals are provided, but they're telling you it's independent living. The way to know if they're kind of misleading or not is ask them how many total apartments do they have, and wait for that answer. And once they tell you that answer, then ask them how many of those apartments are licensed for assisted living. If the two numbers are equal, then you will know you're actually looking at a licensed assisted living rather than an independent living community, if that's important to you. And some places like Knollwood will have an independent living neighborhood and an assisted living neighborhood as well. Our assisted living neighborhood is less than a third the size of our independent living neighborhood though. You'll also have nurses around the clock and aides around the clock at assisted living, and you may or may not have social work. Do we have any questions about that, Helen? Helen's are here helping us with questions.
So assisted living.
Yeah. Well, somebody asked there, do we have separate buildings for independent living, assisted living, and skilled nursing, or is everything in one building? Well, nothing, you're never really going to see any of those three in a life plan community in the same building. A skilled nursing building, so ours are all connected, but you could chop any of them off if you wanted to. So they're all on the same campus, and you can get from building to building without going outside, but each is its own unique building here at Knollwood. Some freestanding communities that will say independent and assisted is one building. So they couldn't chop them apart. But yes.
So it says,
What are you reading? You got to read it loud so they can hear.
it says, so assisted living costs more. If you live in independent living and then you need assisted living, do you pay the higher cost as you're a resident in independent living? So that's contingent. If yes, assisted living does cost more. It's only because you're getting more help, you're providing more services than being independent.
So it is more. It depends on the size of the apartment you have to begin with, but it is significantly more. Just like if you're living in your house, your costs are this much. If you're living in Knollwood in the apartment, your costs are going to be about the same. If you're in your house and one of you needed assisted living, or both of you, or you're only one, and you leave your house, whichever, assisted living is going to cost more. So it's because you're paying for people, around the clock. They're not with you around the clock, but they're physically present for you around the clock.
She wants to know who was the youngest.
We'll save that for the end.
We'll save that one. Okay.
Well, actually, I'll just answer it now. But some of the questions we're going to save for the end because they don't pertain to the slide. But people want to know the youngest ages of people here. We have quite a few people in their 60s here. So, varying different 60s too. So, you have to be 62. So there's no one here younger than 62. That we know. So eligibility. Now, one thing that we are not talking about today is skilled nursing. We'll do that in a different session, probably September. But if you're ineligible for independent living, it doesn't mean you're automatically a candidate for assisted living. You may actually need more care than assisted living provides. Because assisted living is not providing for medical needs. So different diseases, different illnesses, and how they manifest the type of care you need are going to dictate whether you are still eligible for assisted living or not. But to be eligible for assisted living, you still have to be able to live safely in an apartment on an ongoing basis. So even though they're staffed 24/7, they're not physically with you in your space 24/7. So you have to be safe ongoing when they're not there. You have to be able to move about the community on your own. And what does that mean? Vicky?
That means that if you have some adaptive equipment, cane or rollator, walker, you can even move around safely with your wheelchair. But if you're able to do this safely and independently, then you're eligible for the assisted living.
So without someone pushing you or
Without
helping
someone
you.
put correctly.
And you don't have to, not everybody who lives in assisted living has an assistive device either.
That's correct.
So probably more don't than do, right?
Right.
Some people will have an assistive device, but not everybody does. And transfer independently. Vicki, what does that mean?
Still have to be able to transfer yourself independently. Someone can do a standby assist to be sure that if you're feeling a little shaky, but you will always have a nurse or a nursing assistant, as we say, certified nursing assistant, to be there to assist you as far as if you don't feel safe. But you should be able to independently transfer yourself in and out of the bed, in and out of for the toilet,
Chair.
and chair. Absolutely.
Yeah. Get out of bed on your own. Get out of the dining room chair on your own.
Yes.
Get into the dining room chair on your own. And I think probably the fifth bullet does warrant conversation. So continence can become a problem for many people and for different reasons. But when somebody is maybe managing it themselves or they're a willing participant in the management of it, know when there's a concern to be had. But sometimes people's continence can be really out of control, or maybe they're unaware, and that's not going to be appropriate for assisted living. That's going to be beyond assisted living. And the last bullet, we talked about the activities of daily living. If you really needed help with all of them, then the chances are you're probably not an assisted living candidate anymore. You're probably a candidate for skilled nursing. So, and you notice at the bottom of that slide, it actually did say that ineligibility on the previous slide at the bottom was related to medical needs we talked about, but also personal funds. And we're going to get into payment a little bit later, but if somebody does not have funds for assisted living, then they would be ineligible most of the time. And again, we're not just talking about Knollwood. These are generalities that you can apply to anywhere where you may be located. Okay, now we're ready to move forward here and continue on. Now this is about the independent living. Okay. So I'm independent, Vicki's independent. I hope all the watchers are independent, but we're safely and wisely running a household. Okay. My children were coming and checking on me frequently throughout the week, then I'm probably not safely managing a household. Unless they're maybe dropping off groceries for COVID. But typically for somebody who's independent, they're going to be not in need of care, and they will also be still having sharper mental acuities, so not starting to become forgetful, things like that. When we're talking about the money, so independent living, pretty much almost anywhere you would look into for independent living, they're going to expect that you're going to have a certain amount of funds to last a reasonable amount of time. However, if you do look at a rental community, they may not inquire about your funds because they do have the ability to evict you should you either outlive funds or forget to make payments or what have you. But most of the time, there's going to be an expectation that to be eligible, you would have sources of funds. And now we'll move to our next one. Leslie, do we have a question on this one?
Yeah, how is decision of independent versus assisted living made? What is there, is it different?
So the question is, how is a decision of independent living versus assisted living made? Okay. Well, first of all, I think probably, hopefully from this point, you already have a little bit of an idea, right? So, you're not going to be walking in off the street and moving in. You're going to have been here and met with myself or Helen or Vicki. And if we see that you probably are not going to be having an easy time safely in managing a household, we're going to steer you to either assisted living or skilled nursing. Ultimately, after somebody does select, a place here, there is also a health review, but we're not going to direct you toward independent living if you're not suitable. That would be the wrong thing for us to do. And that's how it's done at Knollwood. But, we're going to learn about you, and we're going to possibly ask you some questions if it's not obvious, or if you're on the phone. If you're here with us in person, we can pretty much get a good idea of whether you're an independent living candidate or not. So, yes. So that was a good question. So thank you, and we'll continue on. So a little bit of a comparison from a regulatory standpoint. So for assisted living, what types of people come through and inspect, Vicki?
We have the Department of Health that actually comes in and do what they call they come in and they look at all the licensed personnel, make sure that all the CNAs have their license up to date. They look at all the medications that our residents are taking, make sure we're in regulatory with all the state needs.
So it's regulated fairly heavily. Independent living isn't really regulated. There is some regulation at the state level, and of course, because there's dining here, there's the health inspections of the kitchen and that type of thing, just like there is at any restaurant. There is no care licensure at all, because remember, independent living, you're not getting care. And there is typically every state has some sort of regulatory arm that looks over your residency contract, and for nonprofits also looks at your financial status. Yes. Assisted living, they are licensed to provide personal care services and supervision, and they're licensed to have nurses, and they also have to have licensure for the practical nurses to administer medications. So you can see the list of regulatory comparison is much longer on the assisted living side, because people living in assisted living really need help, and they need someone watching out for them. So it's important to have that regulation. Should we move on to the next one, Vicki?
Sure.
All right, we'll go to the next one. Well, we're back to the test.
We're back to the test.
Now, remember what your answers were in the beginning, and now we're going to ask we're going to kind of repeat the question, but then we're going to tell you the answer and see if you got it right.
Okay. In what type of community does Julie live? Julie lives in a community offering socialization, educational programs, housekeeping, and dining options. She gets around easily, but no longer drives at night. Julie no longer cleans, and she cooks less than in past years. She has diabetes, and sometimes she cheats on her diet. What type of community does Julie live in?
We'll give you a couple seconds before we go to the next slide, but let's go to the next slide, because we're going to show you the answer. Okay? See, so it doesn't matter that she only drives in the daytime and not at night. She doesn't like to clean, but I don't really like to do it either. She cooks less. I find, well, except for during COVID, I cook more. But I used to eat out more, and now I eat out a little less, because it's just not, I'm looking at the storm outside the window right now. And, she has diabetes, but that's, a lot of people have diabetes. I have arthritis. Some people have heart trouble. That's okay. She's managing her life, then good for her. She's perfectly fine for independent living. So now the next test was, we could have done this tricky. Maybe this is tricky. We should do this trickier next time. Yeah.
So in what type of community do Jane and John live? Jane and John live in a community that offers socialization, educational programs, housekeeping, and dining. Both need reminding to take medicine, and Jane gets around easily and John slowly. Jane no longer cleans or cooks, but their apartment has a kitchenette. Jane has help showering, and John has a stable but chronic illness.
So probably made this one easy on you, but we'll see on
Yeah.
the next slide if you got this one right. So we've
Okay.
kind of underlined the things that are the clues that assisted living is the appropriate type of service for somebody. Now, if John, you'll notice the very last sentence, John has a stable but chronic illness. If his illness was acute and unstable, or just acute, then assisted living would not be appropriate. So an example of a stable but chronic illness maybe is, let's say, osteoporosis. So it can be debilitating, but it doesn't typically change day to day. An acute illness might be somebody who's a brittle diabetic, right? One day, the next day can be very different, or somebody with memory loss impairment that puts them in more in a dangerous, a little bit of a danger zone, right? So those are just a couple examples of different types of illnesses. Okay, so we're going to go on and talk a little bit more now. I know people want to know about properties, they might want to know about money and payments. So just to give you an idea, I'm not sure if everybody here is from Maryland, Virginia, and DC. If you're from outside of Maryland, Virginia, or DC, just type in the chat box and I may have some other examples for you. But we have listed 4 different communities that offer independent living on the left side. Now, all of these offer more than independent living, but they're all comparable life plan. The right-hand column are communities that are true assisted living communities. They may also offer memory care, but they do not offer true independent living, and they do not offer skilled nursing either. So we just kind of wanted you to give an example of communities in the nearby area. And then I don't know if we have anybody from outside of our area, but it looks like we don't. And so then we're going to go on now. We're going to go beyond the properties and we're going to delve into payments. So here's another question. So this isn't really a test, but is this true or false?
Medicaid covers assisted living costs. Is that true or false?
We'll get you to think on it for just a minute. All right, let's show the answer now. Okay, so it's mostly false. It's not 100% false. But the reason it's mostly false is there are very rarely communities that will accept Medicaid for assisted living. They have to get a waiver. And while most towns have numerous assisted living communities, they're very rare to find them. And for example, Washington, D.C. does have 2, and believe it or not, for the amount of people and the amount of area that the city of DC takes up, that's a high number. So they're typically hard to find. And then also to receive Medicaid, a person's income threshold, and this is for a single person, has to be less than $2,500 a month. This varies slightly by state, but this is a good average value for you to know. Would you add anything to that? Okay. So now we're going to have another true and false question for you. Medicare covers assisted living. Think about that for just a minute. All right. We'll show you the answer now. You can take this one away.
That answer would be false. Medicare covers short-term stays in a skilled nursing for people whose conditions will improve with therapy or medical intervention. So usually Medicare, there's a 3-night qualifying stay in a hospital. If you have a joint replacement and you live here at Knollwood in the independent living, then you are authorized to continue getting your therapy and or rehab under the Medicare, which will cover your stay up to 20 days at 100%.
Once in a while, not always, but once in a while, if somebody doesn't live here and we have a space in our rehab center that a resident, doesn't have slated, sometimes we can offer rehab for people who don't live here as well. But there are numerous requirements for Medicare, so it's not a blanket statement. And if you're in a hospital for 3 nights, but you weren't admitted, you're just there for observation, you will have no rehab benefit. But yeah, Medicare does not cover any assisted living costs. It covers things that it covers now while you're living in your house. So it covers possibly your prescriptions, hospital stays, tests, going to your doctor, outpatient rehab. Yep. All right. And we're going to look a little bit more into payments then. So if Medicare and Medicaid are not payment sources, what are? So independent living, your personal funds, like living in your house, cash is king, right? So you have bills coming in and you pay them out of your personal funds. It's going to be the same here. For people who have long-term care insurance, if you have a policy that covers assisted living, that's why it says maybe there, if you have long-term care insurance, then it would probably cover some of your assisted living cost. Again, it's mostly personal funds that cover assisted living, and rarely, but sometimes Medicaid would cover it. Yeah. There's nothing. Or sometimes maybe you could get your daughter or son to pay for it.
That's good.
Family member funds, right? Yes. Okay. So we're done with the payment sources. And now we kind of want to give you a little bit about the neighborhoods of Knollwood. So just by the first bullet, you can see that the majority of people living at Knollwood are living independently, and just under a third are either here and living in either the assisted living or skilled nursing neighborhoods. You're going to see mostly single people in the assisted living or skilled nursing, and you're going to see a big mix in independent living. If you do live here in independent living, then even though our assisted living and skilled nursing neighborhoods are small, they're here for people who live here. So it's the right size for people who live here, but it's not typically excessive where we cannot always guarantee that somebody who doesn't live here would be able to come into assisted living or rehab here. Sometimes, so it's worth checking out. And if you're living in assisted living at Knollwood, you do have priority access here for long-term care, memory care, or rehab. And we're proud to say the assisted living has deficiency-free surveys as well. So that's something that's, you can tell by your smile that you're proud of that. Yes. And now, these are some of the amenities that we have on campus. And I'd like to point out 1, 2, 3, 4, 5, 6, and 7 of the bullets. So 6 is ultraviolet sanitation. That's something new. That is definitely COVID related. But we're very adamant about being safe. And so we have some technology that will help us stave off COVID. We don't have any COVID here now, if that was your question. But we have ultraviolet sanitation. It's like a robot, and we are using it in skilled nursing or assisted living. If somebody had to go to the emergency room, or maybe they came in contact with somebody, we can use ultraviolet sanitation. And it's not just for COVID, but for some other types of bacteria to make sure that someone's living quarters are very sanitary. We also have an Abbott lab here of our very own. It's not used for the public, but if somebody has any symptoms, and maybe they have the flu, maybe they have an allergy, maybe they have a cold, but whatever it is, we don't know that it's not COVID, we can do an Abbott rapid test. It is just for residents and staff here. And even our lab has had ultraviolet sanitation just in case. But it's a great thing to have. And so we're very fortunate to have these technologies here at Knollwood. And actually, we've all been tested here because we've tested every employee and every resident, just because Knollwood knows that more than half of people who have COVID don't have symptoms. So everybody here has been tested at least once, if not numerous times. How many times have you been tested?
About 4 times.
About 4 times, yeah. 4 times. Okay. All right. Now, these are some resources that you may find interesting or helpful. They're the first, second, and fourth one are websites. The third one, if you Google that, that will give you an idea on pricing for things like skilled nursing or assisted living nationwide. So let's say you're investigating moving to Alaska, where you have some family, and you're wondering what would be costs, not for independent living, because that's not care, but for assisted living or skilled nursing somewhere else, that's a good source for you to have it. Now, I think we're going to see if we have any remaining questions. I think we're ready to go to our last slide, possibly. Yeah. So it looks like we may have answered all the questions. Do we think we got them all?
Yeah, the last one's just about when we're offering the long-term care insurance review.
So the long-term care insurance workshops, I think we're offering several in August. I believe the first one is